one of the huge issues that we see all the time with rapid weight loss, and
Mhm.
that's why I can't stand that whatever the Ozempic and all those drugs that are being out there, because what's happening is that you are when you're losing all the weight, you're losing the massive amounts of toxins that are
Mhm.
stored in that fat. And then
Absolutely.
they end up dumping back into your system and recirculating.
Mhm.
And then you present with later with again autoimmunity, cardiovascular issues, neurological issues, cancers.
Hi, I'm Dr. Monica Jauregui, and welcome to Truly Healthy MD. I have one question for you. What's really behind the way you feel? As a functional medicine doctor, I'm passionate about helping you uncover the hidden causes of your health concerns and finally connecting the dots. From balancing hormones to overcoming Lyme disease, boosting brain health, or just finding new ways to feel your best every day. This podcast is packed with insights and strategies to help you take control of your health and live wholly. Ready to explore what's possible and be truly healthy? Hello, welcome to the Truly Healthy MD podcast. I'm Dr. Monica Jauregui. Truly Healthy MD is where we empower patients to become truly healthy by addressing the root causes of their illnesses with cutting edge medical science and holistic healing. Today we have a very special guest. I'm so honored to have Dr. Margaret Christensen with us today on the podcast. So, Dr. Christensen, we work in close proximity to each other, and I've been a big fan of yours for many years. When I was, just starting out in the holistic space, I followed you for so long. So this is such an honor for me to have you. Can you please tell us who
Sure.
you are, what you
Yeah.
do?
Yeah, well, thanks so much, Monica, for having me. And I know kind of mold is kind of what brought us together, and I've gotten, expanded to a lot more than that. But I'm an OBGYN by my original training, so I practiced for 10 years, but then got so unbelievably tired and fatigued, couldn't figure out what was wrong. My brain wasn't working. I had terrible brain fog, and I'm a type A personality, and like I
Hmm.
couldn't even figure out how to take a shower with, it took me 30 minutes just to gather my shampoo and, towels and things. So I knew something was really wrong. I didn't know what it was. Because of that, I fell into functional medicine. I changed my diet. I got on some nutrients. I cleaned things up, and all of a sudden I got way better. But I still didn't know what the underlying issues was. About 8 years later, I got really super sick all over again. And that's when we figured out that it was toxic mold. And actually, my whole family had been exposed to it, and my children when they were young. And unfortunately, by the time I learned what was going on, my kids were already in their teens and having some challenges. And basically, long story short, is two of my four children very significant autism spectrum, one very, very severely so, and having all kinds of challenges. And I had such severe chronic fatigue that I had to quit and close my OB practice in order to just recover, and which I did originally with diet and nutrients. That second time around, that's when we figured out. I was very fortunate to be here in Dallas, right next to Dr. William Ray's environmental health
Oh,
clinic,
yeah.
and I mean, he
Yes,
was a
they're great.
pioneer in the field. Yeah.
Hmm.
And so he's the first one who diagnosed me with, very, very high levels of mold
Mm.
mycotoxins. And,
Yeah.
unfortunately, it impacted myself and my family. And that led me down into this journey. And I had to close my OB practice. I couldn't even function at that point. But, think about it. Four babies, 16 years of sleep deprivation between training and having babies of my own and delivering other people's babies. So I was severely sleep deprived, massively nutrient deficient because babies are
Hmm.
parasites and they just suck it
Of
all up.
course.
Yeah,
Mhm.
and then all the
In more
yeah,
than one
golly.
way sometimes. In more than one way. I'm kidding.
Yeah, yeah, no, there you go. And, yeah, and, a lot of people don't realize too the level of toxicity that we're also exposed to in hospitals in terms of,
Oh,
some of the chemicals and the plastics.
absolutely.
Anyway,
Yes.
so
Yeah. Yeah.
I
I
yeah,
actually developed
yeah,
a latex allergy from using latex
yeah,
gloves, and it
yeah,
turned into what's called latex fruit syndrome. So I became allergic to fruit
yeah,
because there's like some chemical similarity. And so, yeah,
yeah,
we're exposed to so much stuff. It's crazy. And
yeah,
I always love hearing the backstory of how we, as conventional doctors,
uh-huh,
find integrative functional medicine, and it's that backstory just means so much to me. And so this, listening to you say that just blew my mind, because I've always been, knew
uh-huh,
that you were a doctor that I admired and I
uh-huh,
loved. I've sent patients to your clinic.
yeah,
I've been to your mold summits and all that. But we actually have a lot of similarities. I also have four
yeah,
children.
Yeah.
And I'm an internist. I was a hospitalist in my prior life. I call myself a recovering hospitalist at this point. I try not to relapse. And in 2019, I just had severe chronic fatigue, fibromyalgia. They were working me up for multiple sclerosis, but all my scans were negative. So they just ended up sending me to a psychiatrist. They're like, something's wrong. We can't figure it out. So maybe some psych meds will help. And I was like, it's not,
Yeah,
it's not
well,
psych. Like, I know it's
that's
not
exactly
psych.
my story. Yeah, I mean,
And
that's my
so,
story of severe chronic fatigue,
yeah,
fibromyalgia, brain doesn't work. Go see this, go see the physical therapist. Here's your pain meds.
I know.
Here's your antidepressants. Nothing was
Yeah.
working, and then that's when I figured out. And then subsequently, so what happened is I had this giant practice in OB, and
Mhm.
that was very progressive here in Dallas, and I closed it because I could not keep functioning. And I took a couple of years off. That's how I fell into functional medicine, found IFM. Fortunately, Dr. Bethany Hayes, who's one of the kind of premier faculty members at IFM in the women's hormones, she really mentored me and taught me, and then I recovered by doing all these things. But as my former husband got really sick with neurological issues, and my children then now they're in their teens and they were getting severe neuropsychiatric symptoms of all this, and again, so I went all down that road and learned how to do neurological workups, cardiovascular workups, psychiatric workups, and understanding the underlying biotoxins. And yeah, and then I've created a large clinic called Carpathia. It's Carpathia Health Collaborative
Mhm.
in Dallas, and so we do a lot of chronic complex illnesses here, and hopefully we'll get to touch on biotoxins in general, not just mycotoxins, which is from mold, but also I'd really like to speak to spike protein, and came from the COVID virus, and really much more spike protein came from those who got and vaccinated. Um, and how that disrupts hormones. So,
I
because
think
hormones
that's
are us, that's my area of expertise, along with
mhm.
biological
Yeah.
toxins and environment.
Well, that's wonderful. I also like to when I talk to my patients, when I talk to the public about toxins, I tell them, there's a few that we can measure. We can get you a urinary mycotoxin test. We can check your glyphosate levels, but there's so many out there that we're exposed to that we don't even know how to measure them. So we're exposed to a soup of toxins, and so it's good to be aware of. Which ones are we measuring? Which ones are we treating? Which ones are we following? How do symptoms correlate? But there's all these other ones that some of them we know about, we're learning more and more about. I love it that even though I don't love COVID-19, but I love how it spurred all this scientific interest in the scientific community to learn more about how these things affect our body, and like that science has grown by leaps and bounds. All these things that were ignored in the past, fibromyalgia and chronic fatigue, are now being at the forefront of conventional medicine and science, being like, oh, there is actually a scientific explanation for this stuff. It wasn't all in our patients' heads. So I love that you want to address it this way, because that's also the way that I look at it, and the overlaps that we have
Mhm.
between all these things. So yeah, absolutely. And yeah, I'm aware of your clinic. I love how it's all very multidisciplinary. So it's a great place. Definitely recommend those people who are in the Dallas area, traveling to Dallas area, to check it out. My clinic also in Dallas. I do more telemedicine, but yeah, I'm so proud to have such great resources in the DFW area, and it's growing. The awareness in our area that the public is growing every day. Sometimes I get frustrated. There's not as much awareness in Dallas as there is in Austin, California, but I think we just need to be messengers of, hey, there's a better way. There's more help that we can give patients than just the limited toolkits. I'm so honored to practice medicine with you as my neighbor. So
Great. Well,
yeah,
let's just a little talk about biotoxins and hormones,
let's do that. Yeah.
because that's the interaction. And I mean, we can use mycotoxins as an example, but the spike protein also has many similarities in terms of what it does to our both our immune systems and our hormonal systems and everything else. So if you look at again mycotoxins coming from molds, there are several different mechanisms in terms of how hormones are disrupted. The first one is what we call molecular mimicry. So it actually
Mhm.
the the mycotoxins themselves can mimic, for example, estrogens. Zeolurone is one of those mycotoxins that
Yeah.
we can measure. So they can have estrogen-like effects. They can disrupt testosterone. They can disrupt thyroid function and all that. So that's molecular mimicry. Another way that you can see a massive disruption in that is that gastrointestinal tract. So we know that all of our hormones, as well as our immune systems, 70% of our immune system is in our gut, and our hormones are actually metabolized and balanced in the liver in the gastrointestinal tract. So when you have exposure to not just mycotoxins, but all the other stuff that's in the standard American diet, antibiotics,
Oh, yeah.
chemicals, glyphosate, et cetera, then you again have these molecular mimicry issues, and then you're triggering the gastrointestinal tract and the bad guy bacteria to overgrow and disrupt. And then what happens when that happens? We have a nerve called the vagus nerve that connects the brain and the heart and the gut, and it's mostly sending signals all the way up into the brain and into the brain part of the brain that's called the limbic system. So
Hmm.
again, if you have a lot of gut issues and disrupted gut because of antibiotics, because you've had bad COVID and had spike issues, because you have chronic mycotoxins, then you're getting this chronic distress signal that's going up into the brain, into the limbic system. Well, what's the limbic system? The limbic system involves kind of three major parts. One is the hypothalamus, the master regulatory center of all the hormones and all of your sleep-wake cycles. And, is it time to get up, to go to sleep, to have sex, to, procreate, um, to kind of to do whatever.
Hmm.
And
To relax, to
right,
work. Yes.
relax, right. Yeah, so that's the hypothalamus. And then you have your amygdala. So the amygdala is the fight flight center of the brain. So that's actually what is constantly scanning their environment. Is there
Hmm.
a tiger going to jump out at us? And so that's the amygdala is what's sending the signal to the adrenal glands to say, hey, run or fight, 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 or freeze. The other one is fawn, which is like being overly kind, overly obsequious to everybody to try and support everybody. But
That
fight
is
or
new one
flight,
to me.
yeah, yeah. So
Great.
a lot of people don't. I mean, they've heard of fight flight,
Hmm.
and then freeze happens when you can't when you can no longer run or fight. Yeah, so again, you have gut disruption ascending the vagus nerve, getting into the limbic system with the hypothalamus, the amygdala, and the other piece of the limbic system is called the hippocampus. The hippocampus is our memory center. So again, sight, sounds, smells, things that have happened to us in the past, traumas, those are all stored there. And they can get triggered by anything that you see, you watch, somebody says a word to you, they looked at you wrong, and what you don't realize is that you have a memory that comes up that's completely unconscious, that maybe you were a little kid and somebody screamed or yelled at you, or car wreck, or
Hmm.
something. But the body and the part of the limbic system then gets activated and it stays in the chronic fight or flight stress mode. Well, then the third mechanism then that we talked about, molecular mimicry, gut and vagus nerve combination. Um, then you have the olfactory nerve. So that's your smelling nerve. It's the little shortest nerve in your body from the back of your nose going right back into the limbic system part of your brain. And by the way, it's bypassing the pituitary gland, which is
Yeah.
actually what signals everything
Hmm.
from the hypothalamus. So now you've got this inflamed olfactory nerve going back into the part of the brain that's called the limbic system that's really got it charged up and constantly sending signals of distress. This is part of what happened with COVID too. And if you had underlying mycotoxins and mold, then the likelihood of you getting much sicker with COVID or with the vaccine and having long COVID symptoms was much, much higher.
That
Part of
was
it had to do,
exponential, right?
yeah, yeah, because of again, this inflammation in the
Hmm.
limbic part of the brain. And then, so what happens? So that's all on fire, and you got your hypothalamus, and they're trying to regulate your hormones, and it's getting all kinds of signal and crossfires, and the nerves are inflamed in there. So this is what creates a lot of disruption in hormonal cycling, as well as high levels of stress hormones and cortisol, and then. The other thing that happens, of course, we know certainly during COVID, what happened that you couldn't smell if you got COVID, right? And that's the
Hmm.
olfactory nerve was
Yeah.
inflamed,
Yeah.
right? And that happens with mold. So those are some of the major mechanisms, the molecular mimicry, and then again we talked about that HPA axis, the hypothalamic pituitary adrenal axis.
Mhm.
Yeah, that gets turned on because of the limbic system in the brain, and you just stays, you kind of stay in this heightened sense of kind of disruption. So those are some of the major mechanisms by which um, uh, all biotoxins, which are, and we can talk about what a biotoxin is anyway, besides
Mhm.
mycotoxins,
Yeah.
what it means, um, can disrupt. So yeah, and I would just say a biotoxin is a tiny fat soluble toxin that gets inside our cell membranes. So we have cell membranes that have two layers,
Mhm.
water soluble on the outside, uh, kind of an oily layer like olive oil on the inside of the cell membrane, and it's supposed to be that way. And it helps where the receptors sit like potatoes in that cell membrane, and you have oxygen and nutrients coming into the cell and energy and toxins going out of the cell. But if that olive oil it starts getting full of these fat-soluble mycotoxins, heavy metals, spike protein, pesticides, plastics, get stuck in there, it turns that olive oil into chunks of lard. And it doesn't
Mm.
work,
Oh
and
man.
they doesn't work, and you can't produce energy well. Mitochondria become disrupted, and that's probably the other major mechanism of action of all biotoxins is disruption of mitochondrial function. So
Hmm.
remember, mitochondria, powerhouse of the cell,
Yeah, yeah. We get this
producing
severe
energy. Yeah,
fatigue.
yeah,
Yes.
yeah. So you get that's the fatigue, the chronic fatigue, the fibromyalgia was the aches and pains and
The brain
inflammation
fog
of the
too.
system,
The mitochondria
brain
in our brain are
fog.
so important. Yeah.
Yeah, yeah. So all of those things.
If you like this discussion, please hit the subscribe button and consider leaving us a review. It really helps people find us, and we truly appreciate your support. Yeah, and I think what's really interesting about biotoxins is just thinking about the size. Sometimes a lot of the things that we measure in medicine, they're much larger particles. A lot of these biotoxins are very hard for us to measure because they're uh, zero point 0.1 microns, which is a little thing. And so
Mhm.
the science just isn't there to measure a lot of these. And that's why I believe it's been so hard for us to understand what's going on. Not only is there a multitude of all these biotoxins that are around us, but it's so much harder to measure that than it is, let's say, an allergic reaction to mold. People know about allergic
Right,
reactions to mold
right,
because we
right.
can measure that in our IgEs and blood work. But measuring the actual mold particles, there are some tests to measure that, but it's not as straightforward. And it's just that's how tiny they are and how disruptive to me is super important to understand the why patients present with such severe symptoms and their labs tend to look normal because it's not something that we can pick up on conventional labs.
Well, on conventional testing, and
Unconventional, yeah,
I would probably also add to that that we are taught nothing, zero, in medical
absolutely,
school and in
yeah.
residency about environmental medicine, and there's
Mhm.
probably big and good reasons to that, and that has to do with the link between big pharma, big ag, big food, big chemical, and hopefully all of that is going to come falling down shortly.
Yeah, and yeah,
Because
that's
yeah,
another
our
thing I
food
was.
supply, yeah, food supply is toxic. Our
Mhm.
air, our water, all of those things that we're consuming have these little teeny tiny biotoxins in them, again, that can get into those cell membranes, and that's disrupting. And we learn nothing about that
Mhm.
in our training. So
Yeah,
yeah,
we don't. I
unfortunately, we
think
have to get sick
maybe.
ourselves to learn this.
Yeah. I think maybe one time in one of my med school classes, they mentioned aflatoxin just as a really quick thing, right? Like,
Yeah,
oh,
right.
in Africa, people sometimes get sick because their corn supply is toxic with aflatoxin, but that's like the only mycotoxin they talked about in all of my medical training. And then come to find out that like things like a drug like Cellcept is a really strong drug that's derived, I don't know if it's from a mycotoxin or similar to
Yeah,
mycotoxin.
mycophenolic acid.
Yeah,
Yeah, so
mycophenolic acid. So it comes from a mycotoxin, and we use it for transplant recipients, and we use it to really suppress the immune system. So that tells you the power, and that in conventional medicine we are aware to some extent, but obviously not to the degree that we need to be aware of all these things.
I mean, so the type of symptoms that we're seeing, and again, I'd like to address COVID because there's a lot of people talking about mold. I did a mold summit, I don't know, 5 years ago, and that's still circulating, I think,
Mhm.
around. But um, again, what we have seen with spike protein toxicity, and we understand that this was a genetically engineered piece of the COVID. The COVID virus was genetically engineered, and it was, I don't know if it was released or escaped from the lab. It doesn't matter, but needless to say, again, we're seeing massive amounts of disruption of mitochondrial function and cell membrane function. And how does that present? It presents in autoimmune issues. In women, we're seeing massive amounts of hormonal abnormalities. And a lot of women noted after they got the COVID shot, or even being around other people who received the vaccine, the abnormal periods. We've seen a 20% drop in birth rates. We've seen, I had a number of ladies on low dose hormone replacement therapy, postmenopausal, no issues, everything's cleaned up. And all of a sudden started bleeding out of nowhere, including an 80-year-old. I had 3 fetal deaths, and I don't even do obstetrics anymore. But what we do is help ladies with fertility. And by the way,
Mhm.
ladies out there, if you're having any fertility issues, it's toxin related, toxins and stress hormones and nutrient deficiencies, those 3 things. So again, fetal abnormalities, fetal deaths, and abnormal bleeding periods, turbo cancers, 800% increase in new onset autoimmune issues. And all of this stuff is documented. None of it is conspiracy. This is all real things, and people really need to wake up. So if you have been exposed to the spike protein and you also have a lot of high body burden of mold and or Lyme, then you're a person that's much more likely to, quote, get long COVID. Well, long COVID is, that's what I said at the beginning of all this. I said, I've been treating long COVID for 20 years. I mean, that is what chronic fatigue, fibromyalgia
Exactly.
is. It's, often it's infections and biotoxins and nutrient deficiencies
Mhm.
creating this disruption in our bodies. And so um, the good news about this now is that we are able to, there are all types of protocols that we can utilize, very similar to some of the mold and Lyme protocols that we can use to help break down that spike protein, help clear it from the body. But unfortunately, again, in some people, and there were some batches of this stuff that was much more toxic than others, and really create a lot more problems, including we've seen very high rates of myocarditis and heart inflammation, particularly in young athletes, very high rates of sudden death, and the elderly. And a fabulous report recently came out, a bipartisan report from Congress on the COVID response, really showing that nothing worked. No shutdown, no lockdowns, masking, social distancing. It was all complete and total BS. And unfortunately, it really damaged our children and our mental health. And, I mean, and how do you brainwash a population? How do you brainwash a population into believing that, that the only answer, and this is where my medical colleagues failed. They failed their Hippocratic oath of do no harm. They just jumped lockstep into what we were being told because, again, that is part of how we're trained. Don't ask too many questions. And so a lot of people became injured. And if you have, again, underlying other issues, mold or Lyme, then you're much more likely to have that long response. And then you and I know how to approach it to help to turn things around. And one of the things that we can do is there's some hormones that can be very helpful to at least support the system until you can get further evaluations.
Okay. And which hormones are those?
Yeah, so I think the kind of the top 2 things that you can use are DHEA,
Mhm.
which is available over the counter. So I'm just going to talk about what's available over the counter.
Yeah.
Yeah, so again, if you've had, and this goes for really anybody who's been dealing with chronic stress, any kind of long illness, but really, like you said, we're all being exposed to all kinds of toxicity all
Yeah.
day, emotional, psychological, and physical, and spiritual. So DHEA helps to support your adrenal glands. Now, for women, 5 to 15 milligrams a day is usually the dosing that I use. For men, it's 25 to 50. DHEA is a precursor to cortisol.
Mhm.
It's also a precursor to testosterone. And so if you are making a lot of stress hormones all the time, high levels of cortisol all the time because you're afraid, because you're isolated, because you've got mold and you don't know why you're so anxious,
Because you're sick. Yes.
all that, yeah, yeah. So you are dumping stress hormones all the time, then again, that's going to keep your body in this fight or flight state all the time. And it's very hard to recover. And fear is also used to manipulate people. Fear and isolation is the number one way you brainwash people. And so here we had all these lockdowns happening. And then if you lived in a moldy house and you're stuck there and you're stuck there with your kids and everybody's kind of going crazy, and you're being fed all this information that has turned out to be false. And there's some of us that knew in the beginning that there was a lot of tactics going on that were being used against us. Yeah, so what you can do is you can use DHEA to help rebuild an adrenal system that has been depleted because you've been in so much fear or pain or inflammation all the time. So, like I said, 5 to 15 milligrams a day for women, 25 to 50 milligrams a day for men, and that's something that people can do over the counter. The other thing that is available over the counter is natural progesterone. And I'm very fortunate to have Dr. Anna Kabeka in my office here. She's the girlfriend doctor. If people don't follow her on, she's all over the internet. But she has a great product. She has a number of great products. One is called Julva. Julva has DHEA and pregnenolone in it. It's a topical cream.
Mhm.
It's to be used on the vulva to help with libido and again help the tissues down there. So that's one way you can take the DHEA, or you can take it in tablets. The other the thing that I use again is natural progesterone, and she makes one that's called Balance, the Balance cream, that has both progesterone and pregnenolone in it. Now, and both men and women can use it. Women naturally produce progesterone in the second half of their menstrual cycles.
Mhm.
However, again, chronic stress all the time, you get we call in, the cortisol steal. You're changing your enzymes to make a lot more cortisol, and you're not making enough natural progesterone to balance the estrogen. I mean, so you got all this estrogen dominance, heavy bleeding, uterine fibroids, infertility issues, bad cramps, migraines. Those are all things that can happen from having too much estrogen, not enough progesterone. So we can use a little bit, uh, you know, uh, usually about 20 to 25 milligrams of natural progesterone topically in the second half of the menstrual cycle, days 14 through 28. Or if you're a perimenopausal woman, I have you do it 3 weeks on, 1 week off, 1 week off during whatever your period time is, and then 3 weeks on. And progesterone, natural progesterone, again, helps that balance.
Mhm.
Progesterone also helps support your adrenal glands. It improves the quality of your sleep. It improves the conversion of your thyroid, of the inactive form of thyroid into the active form, what's called our T4 into our free T3. Progesterone helps with that. So, and progesterone is also very good for any kind of head injuries, neural inflammation.
Oh, yeah. Mhm,
Yeah.
yeah, I've seen where there's studies where they give it to both men and women, and it helps them recover from head injuries. It's
Mhm.
pretty amazing, and I do like talking a lot about the different benefits of progesterone because there's this myth in conventional medicine that if the only reason to take it is to avoid women from bleeding if you give them estrogen, that's the only use of progesterone, but that's so untrue. Progesterone has so many other actions in our body that it's awful when women are given only estrogen and no progesterone because they had a hysterectomy. They're
Right.
missing out on so much, and not only are they missing out, it's almost dangerous to do that. So
Absolutely.
it's
Yeah.
important for people to understand, people who are not medical professionals, and to get the point across to other medical professionals that progesterone has so many other reasons that it's in our body, and we do need to provide patients, help support this in patients who are lacking it. So
That's right.
I love that rundown that you gave us of all the different things that it
Yeah.
does, and more, so much
Yeah,
more.
bone health, brain health are all involved in progesterone producing testosterone. And again, progesterone is good for men too. We use that same balance cream, and we'll have guys put it on their testicles because it raises their natural testosterone. Now, I do want to be very clear that there's a total difference between synthetic progestins. That's
Mhm.
what's in birth control
Yeah.
pills. That's what's in a lot of these IUDs. That's what's in conventional synthetic hormone replacement therapy, are progestins. They have a completely different mechanism of action in the body than natural progesterone that our bodies would make. So you want bioidentical natural progesterone if you're going to be taking it.
Yeah. And my understanding is that when they did like the health for the Women's Health Initiative, it was not bioidentical progesterone, right? It was a progestin that they used at that point.
They
Yeah.
were using Premarin and Provera. Yeah. So, yeah, and the idea also that estrogen causes breast cancer is false. It can fuel it, but breast cancer is being caused again by
Toxins.
local toxicity,
Yes.
toxins, nutrient deficiencies, and
Mhm.
high stress hormones. And
Absolutely.
yeah, and so if you have that whole mix, and then you're pouring a whole lot of high levels of estrogen on it, that's going to fuel the fire. So
Mhm.
what we want to do with anybody is work on detoxification, work
Mhm.
on lowering stress hormones, and particularly improving the quality of sleep, and improving gut function. And those just doing those things can radically change your metabolic pathways and
Mhm.
help you heal.
Yeah, and I've heard a lot of women, once they start an adequate amount of progesterone, it helps them so much with their sleep. And once you're sleeping well, everything else starts falling in place. You feel less stressed out. So there's a very cool interplay between those two.
Yeah,
Making sure
yeah.
that my female patients are on the right amount of progesterone is one of my main priorities in the first few visits.
Yeah, absolutely. And, and then kind of coming back to the sleep, that the topical progesterones will help with sleep quality. But if you're having a lot of anxiety, really significant sleep disruption, then you want to take it orally, and that does require a prescription.
Correct. Yeah, because when it goes through the digestive tract and through the liver, it's metabolized into something different that doesn't happen when we put it on our skin, right? Allopregnanolone, I think it's called.
Yes, yeah. So that's absolutely right. Yeah. So when we're taking something when we take the progesterone by mouth, one of the metabolites of it has GABA-like properties.
Mhm.
GABA is one of the neurotransmitters that's very calming on the brain
Yeah. Yeah.
and
I
very
tell my
nourishing.
patients, it's
Yeah.
some people call it nature's Xanax, and they're like, oh,
Yeah.
please give me some.
Yeah.
I
Yeah.
need that.
Right. Yeah. Yeah.
Yeah, that's so interesting, all the interplay between the hormones and the toxins. So that's a
Well, and if we want to, I mean, and this is, I mean, it's like such a duh. Why are we seeing all this gender confusion? And one of the huge problems is the levels of, again, toxins that women are being exposed to during pregnancy, that are hormonal disrupting, and then the food supply itself and the water and all that, where you have micro levels of, again, these endocrine or hormonal disrupting toxins, and it's impacting things like brain development. And we also know that 90% of transgender individuals, or especially the younger ones, are autism spectrum. And what is autism spectrum? Again, it's a toxic nervous system.
Mhm.
And it is, and what are the toxins? Heavy metals, plastics, pesticides, again, mold mycotoxins. Where are all those heavy metals coming from? They're mostly coming from vaccines. And we've changed our vaccine schedule. When I was born, then by the time I was 18, I had 6 doses of different things, and now what's on the children's schedule for vaccines from the CDC schedule, 77 different doses, including the COVID vaccine, which is not even a vaccine. It's a genetically modified therapeutic agent. Um, that's what we're introducing into our children. High levels of cancer, ADD, autism, autoimmune issues. I mean, I never saw young women with autoimmune diseases like
Mhm.
Crohn's, like lupus, like a lot of severe eczema, until the Gardasil vaccine came out. That is one of the worst ones because it has the highest levels of aluminum. But again,
Mm.
you have a series, a series over time of dumping all these very pro-inflammatory toxins and heavy metals, and adjuvants that are in those vaccines, um, uh, all of them, that accumulate over time. They start triggering dysfunction in the immune system. And then maybe you're being exposed to a little bit of mold, but your detoxification mechanisms have been slowed down or mucked up because
Yeah,
of the
overloaded completely.
overloaded, and then you can't get rid of that, and so that builds up. And I think the other point that we want to talk about in terms of biotoxins, they're fat soluble, so that means they accumulate over time unless you are
Mhm.
working to get them out of your system. So
Absolutely, yeah, and the
yeah.
more excess adipose tissue you have, the more you have reserves to build them up.
Well,
Um,
and see, actually, it's the other way around, because what we're understanding now, it's the level of toxins that are in the food and water and air that are creating the disruptions, causing the insulin resistance, causing our bodies to store fat on purpose to try and
oh my
isolate that.
gosh,
So,
I never
um,
thought about it that way.
yeah,
Yeah,
no, one of the huge
total
issues,
sense.
yeah, one of the huge issues that we see all the time with rapid weight loss, and
Mhm.
that's why I can't stand that, whatever the Ozempic and all those drugs that are being out there, because what's happening is that you are when you're losing all the weight, you're losing the massive amounts of toxins that are
Mhm.
stored in that fat. And then
Absolutely.
they end up dumping back into your system and recirculating.
Mhm.
And then you present with later with, again, autoimmunity, cardiovascular issues, neurological issues, cancers. So we are very judicious in how we use any of those semaglutide or Ozempic type medications. We can use them, but we don't use it until we open somebody's lymphatics. We've
Mhm.
worked on the gastrointestinal tract. We've upregulated their liver detox mechanisms, first, and open things up, and then flushing their bodies a lot of times with IVs. Lots and lots of nutrients, lots of electrolytes and minerals to help move that out, making sure that you're pooping. Do not
Mhm.
ever take anything for weight loss if you are not having 2 to 3 bowel movements a day on a regular basis.
Absolutely. Yeah, that's one of the first rules when a patient comes to see me is making sure they're not constipated, because that's the very first thing. If we're not pooping,
Yeah.
we're not peeing, we're not sweating, then we're not eliminating these toxins. So those were the first conversations I typically have with patients are, how are your bowel movements? And nice to meet you. um, so
That's
yeah,
right.
and yeah,
Poop and sleep. Those are the two
those
things I
are
go after first.
I know, like all the things that we worry about in babies, we also need to worry
Right.
about in
There,
patients that are all
right.
older.
There you go.
And yeah, I love supporting patients when they want to lose weight and they want to do it in a healthy way. And I do tell them, as you lose fats, not only do we want to make sure we're monitoring the amount of muscle mass, so you're not losing that too. We want to be building that. We want to do it very slowly because your body will be uh, overwhelmed with all these toxins. We need to make sure your detox pathways are open and have very, very, very slow. If you come to me and you're overweight, we'll talk about it. We'll see how much of a priority that is with other things. And a lot of times when people start detoxing, the weight just starts coming off. And now it makes so much more sense with what you said, because the body's trying to put on weight to store those toxins. So once the
It's
body
trying to
can
store
manage
it.
the toxins, they're not exposed to so many, the body says, I don't need all this extra fat. So I'm glad you explained it to me that way, because that totally makes sense. And I've seen it time and time again. People start healing their bodies, they're exposed to less toxins, they detox, and then they don't even have to work hard at decreasing their fat because it just happens. The body wants to be at a healthy weight. We just it just can't be if we're overloaded with toxins.
Well, and one of the another hormones that a lot of people maybe don't hear about much is called leptin.
Hmm.
There's leptin and adiponectin, which that's something else that is involved in storing fat. And leptin levels can get very high with mold toxicity.
Hmm.
Again, so the body is purposely trying to store the fat. So, we have a lot of people that because they're overweight or said that they beat themselves up. I'm eating clean. I can't, why can't I lose weight? You're toxic and you probably genetically need more nutrients than you're getting. And yeah, so we
Absolutely.
got to clean it up. Yeah. So
Yeah, and instead of trying to undereat to try to eat less calories, you need to focus in on not overeating necessarily, but eating enough nutrients to be able to detox, to be able to build muscle. And so the whole diet culture is awful.
yeah,
It's so awful. And I love trying to improve the way the relationship people have with food, because
yeah,
people see as food as the enemy and they need to have more willpower to avoid it. I'm like, no, none of
yeah,
us have enough willpower to do that. We just need to understand what our bodies need, feed it correctly, detox, and all those struggles that you're having, beating yourself up because you're not in the gym enough hours, because you don't have enough willpower to not eat certain things, it becomes so much easier. It's just our bodies are
yeah.
naturally primed to be healthy, but there's so many misconceptions that have been circulating for
Yeah.
decades that
Well,
make one.
I call it overconsumption malnutrition. So we have lots and lots of calories, but no nutrients in them. So
Mm,
what we are looking at is a high nutrient diet. And I know you like to kind of end with what are the top things that I tell folks,
absolutely.
the
Yeah.
top 4 things,
Mhm.
and you can find this on my latest summit called Hormonal Havoc, the COVID Fallout and How to Fix It, where I go into depth about everything I just said.
Awesome, awesome. But yeah,
Yeah,
yeah, like
yeah,
you said, at the end of all my podcasts, I always want, this is a ton of information, and I'm so happy for our listeners that they're getting informed, but it might be an overload. So Thank you for being here to
Okay,
our
well,
listeners.
let me
Thank you.
let me just
Yeah,
tell you what
no,
those
I'm
things
not
are.
closing yet.
Okay,
I'm just
yeah.
saying, I'm just
Okay,
telling to
good.
our listeners, thank you for being here. You can listen to it again. But
Yeah.
if you're gonna go
Yeah.
away with these 3 or 4 things, let us know, Dr. Christensen, what are the 3 or 4 things that you want people to
Okay,
just keep in mind
this
after they listen to this?
if you remember nothing else about biotoxins and biotoxin illness, clean food, clean air, clean water, and a clear mind. So clean food would be organic, very low simple carbohydrates, all complex carbohydrates, lots and lots and lots and lots of vegetables. Follow Dr. Terry Walls. Maybe you've talked to
Yeah.
her. Yeah. Clean air. Everybody needs to have air filters in their houses these days. Yeah, so, high quality HEPA filtration to keep your air clean because we're breathing in all that stuff that's impacting our olfactory nerve, creating all that inflammation. Sinus rinsing is something else that you can do on a regular basis to help wash that out. Clean food, clean air, clean water. Make sure that you're drinking filtered water. Stop drinking in plastics. Oh my God. I mean, we're all
I
getting
know.
credit card worth of plastic every day. No wonder everybody's, fat and can't figure out who they are.
Mhm.
So clean water and then a clear mind. This is where we have to work on the limbic system, calming down the stress hormones, learning how to get out of the fight or flight mentality and the PTSD and the over and over circulating thoughts, which is what happens very often too with people with mold toxicity. Again, we have these massive inflamed brains. So this is where I do a lot of limbic system retraining, primal trust, Gupta amygdala, Annie Hopper's DNRS program, daily prayer, meditation, gentle movement. Those are all things that helps to clear the mind. And then, again, just staying super, super hydrated with electrolytes and minerals, and not just water, electrolytes and minerals. Those, and that would be part of the clean food category, clean water. Yeah. So that's what I would say. And there is always, always hope for health and healing. Yeah.
Absolutely. Yeah. And thanks for breaking it down that way because I think a lot of times people feel like they need to take a lot of supplements or have a very complex regimen to heal. But if they're not addressing those basic things, they are not going to heal. It doesn't matter. You can take heaps
Yeah.
and heaps of supplements or
Right.
do all these other things, but starting with those basics is so important for every single one of us. I'm so glad that you laid it out that way
Yeah.
for me and for our listeners. Thank you so much for all this information. This has
And you
been
can
full of
find, and you can find out more. I have a website, molddetoxdiet.com, where we have both for laypersons an entire program to help take you through all of the many things that I just said. And then we have a course for practitioners called Advanced Mold Immune Module that goes through all this. And all I can say is that if you have long COVID, both, I mean, it all applies. On that website, too, there's access to an ebook on hormonal havoc, the COVID fallout, and how to fix it. That's the summary of the 60 different interviews that I did on what happened during COVID and how it's disrupting and the role of other biotoxins like mold, like heavy metals and stuff interacting with spike protein and how we can turn it around and reverse it. And also how we can learn the truth. Our First Amendment rights were completely taken away during COVID, and people need to, and for physicians in particular, if you spoke up, if you questioned the narrative at all, then you were censored, deplatformed, called a quack, delicensed in some places.
Oh, yeah.
But yeah, people need to learn. Yeah, and all of that can help you clear your mind, because there's so much cognitive dissonance going on, okay, we're being told one thing, but that's not what I'm seeing here. And
Mhm.
that is part of what can, so the more you understand the underlying truth, again, it's like the root causes of what's going on, we can, and our bodies are, given by our creator are so amazing and have amazing ability to heal. So you can do that. So check us out at molddetoxdiet.com.
Wonderful. Thank you for all that information. Thank you so much for being here, and we'll talk again soon.
Okay, sounds great.
Thank
Thanks so much, Monica.
you.
All right.
Thanks for listening to Truly Healthy MD. I'm Dr. Monica Jauregui, and I'm so glad you joined me today. Remember, your health is in your hands, and every choice, no matter how small, can move you closer to feel your best. If you found today's episode helpful, please subscribe, share, and leave a review. It means so much to me. Until next time, take care of yourself and stay truly healthy.